following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to Ask the Behavior Doctors, episode 12. We're here at Scottsdale Pediatric Behavioral Services. My name is Dr. Jacob Boney, and we're here in Scottsdale, Arizona, answering your questions, your interests, anything that you guys want to know as parents, professionals, from behavior professionals like myself. We want you to submit those questions to us. Continue to submit those to us at info@scottsdalepbs.com, and certainly visit our website at www.scottsdalepbs.com. So today we're going to answer a question that I've been getting a lot recently. I get a lot of calls from parents seeking therapy, but parents don't know what type of therapy to seek. So they'll call me and say something like this: Dr. Jake, my child they don't seem happy. They seem really anxious, or they seem to kind of have some depression symptoms. You're a behavioral therapist, so what type of therapy would be good for my child? How do I know what kind of therapy to get? How do I know what to look for in a provider for the type of therapy that I'm looking for? So I wanted to tape a segment today to answer that question and to educate parents about the basics and the different types of therapies for children. So we're going to separate them in three big areas: play therapy, CBT, kind of talk therapy, and then what I do is called intensive behavioral therapy, based upon the principles of applied behavior analysis. So I've had experience in training in all three of these areas, and I can tell you from my perspective that they all have their own strengths. They all fit a specific patient population really well, and they all certainly have their uses. So let's start with the first one, play therapy. Play therapy is called exactly that, play therapy, because it uses the language of play to assess, analyze, and treat children's issues, children's concerns, okay? The theory basically goes that children's language, their world, their perspective is demonstrated by and demonstrated through the use of play, that children know how to best express themselves and understand their world through actions of play. So what play therapists do is they utilize play-based techniques, play-based strategies, play-based methods to work with that child. They can use play with dolls, houses, families. They can use a sand tray. They use projective techniques. The nice thing about it is it's very experiential, meaning it's process-oriented. It's in the moment. So all it requires the child to do is reflect and analyze in the moment. Also, too, it uses, like I said, play as the language. So play therapy is great for younger children who don't probably have the language or insight yet to maybe express their emotions completely or express their feelings in more advanced terminology. Okay, so that is one of the nice things about it, is it doesn't place demands outside of the session. It is very experiential about in the session what's going on. Also, again, it doesn't place a major demand on the child's language or consideration of advanced variables. Play therapy is really, really good for children with emotional types of issues. Any child with anxiety types of issues, depression, children who are shy, who have difficulty expressing themselves. Language may not be the exact strength. It also is great for children who do have advanced language, but who prefer play as their outlet of expression. It's fantastic for children with adjustment issues. So let's say a child just went through a major divorce with parents and is having a really hard time interpreting how that affects them, or what's going to happen to them, or maybe they're scared, they're worried, or they're just concerned, they don't understand what's going on. Play therapy would be a great way to address some of those adjustment issues. A major move, a major change in life, any types of major adjustment issues, play therapy is going to be really good, especially for young children. Trauma and abuse and neglect. It's really, really good for that. A lot of children have no idea how to interpret, express, understand trauma, abuse, and neglect. And play therapy does a great way of breaking that down into understandable language and interpretation for children. So I tell parents all the time, if you have an especially young child who has somewhat limited insight or may struggle to talk about their feelings and emotions, who really seems to like and express themselves well through play, and who has any kind of advanced emotional issue, adjustment issue, trauma, abuse, neglect, any type of adjustment in life, anxiety, depression, all of those things are going to be very, very amenable to play therapy. There are a lot of great play therapists out there. Go onto Google, just type in play therapy in your local area. Go to your insurance provider and ask for someone who is a child therapist, child psychologist, child therapist, and ask for play-based type of therapy. Those are going to be good ways to find that. So the next kind of therapy that there is what's called cognitive behavioral therapy. This can be used for, so play therapy, going back to that, I've seen it used for children as young as 2 years old. Cognitive behavioral therapy is probably going to require the child to be a little bit older. So cognitive behavioral therapy is exactly what it sounds like. You're analyzing cognitive and behavioral patterns. You're assessing those with the child. You're figuring out maladaptive patterns, and then you're trying to replace those patterns with more appropriate patterns. So typically, and this can be called talk therapy sometimes, it does involve a lot of language, a lot more language than play-based therapy is going to involve. And it's not just process-oriented. It does involve some insight and awareness outside of the session. So you're going to talk about a lot of things that happened outside of the session in addition to inside of the session. So this is my point. Typically, children need to be a little bit older. I found that CBT therapy is harder for children under the age of 5. If you're really skilled at it, maybe you can do it with children who are 4 and older, but I typically find that 5 and older is going to benefit the child. You talk a lot about, well, what were you thinking when that happened? So that anxiety episode. So let's go back to that. What exactly were you thinking before that started? What were you thinking during? And then what did you think after? So you're analyzing, again, a lot of those cognitions, a lot of those patterns. So typically I find that verbally inclined children do really well with this type of therapy because, like I said, it is more talk-based. So does the child have the vocabulary? Does the child have the language skills to participate in cognitive therapy? Number 2, it requires a lot of insight, awareness, especially into feelings, emotions, thoughts. So if your child struggles with finding insight in episodes, like, so if you frequently ask your child, what were you thinking then? Or what were you feeling then? And their best answer is, I don't know, or I don't remember, or I have no idea. Well, then cognitive behavioral therapy might be kind of difficult for your child to participate in. So cognitive behavioral therapy is really nice for children who are highly verbal, who definitely have that insight and awareness, and children who are show that ability to self-correct, self-initiate, and self-manage. Remember, what the therapist is going to do with the child is try to build new cognitive patterns, but you need the child to be aware of those cognitive maladaptive patterns. You need that child to be able to be aware, to stop, and to adjust, and to think something else in that moment. You also need that child to be able to report on their behavior from the past week, report on their thoughts. You need that child to be able to make some of those self-sustained adjustments. So it is going to be good for older children. It is going to be good for children that are a little bit more verbally able. It's going to be good for children who have more advanced insight and awareness into their own process and experience. So now we're going to get to the last type of therapy, which I do, is intensive behavioral therapy based on the principles of applied behavior analysis. Remember, ABA is not a type of therapy. ABA is a field of science. Yes, there is therapy called ABA therapy, but it's intensive behavioral therapy based upon the principles of ABA. So this type of therapy can be used for anybody. However, the evidence base is there's no real age requirement for ABA. You can be extremely young. We take children as young as 2. Typically, when we see major bursts in behavior or major behavioral deficits or major behavioral excesses for children under the age of 2, we see a lot more biomedical causes to that behavior. So we don't like to intervene too much for children much less than the age of 2, just because you can get a lot of complications with those medical issues. So we'll take children as young as 2, but we'll go up to any age. I mean, we take 2 to 22 here at Scottsdale PBS. So the age thing is nice. We treat based on behavioral excesses and behavioral deficits. So we analyze the behavior, and the child really doesn't need to have a lot of insight. You can change behavior without talking quite easily. As a matter of fact, you can change behavior sometimes a lot more efficiently without words than you can with words. So a lot of learning can occur without having to explain or utilize advanced processes or advanced language, advanced insight into why or what you're changing. It's the best treatment to change behavioral issues. Now, I typically would not recommend ABA for a child with trauma, abuse, neglect types of things. Not that it's not effective with certain behaviors, but that I think children need a form of expression and outlet when they have those issues. And ABA is certainly not that. ABA is not talk-based. We're not typically going to analyze the child's thoughts. There's nothing with processing in the moment what's going on. What we're doing is we're selecting a target behavior or a group of target behaviors, and we're focusing on implementing environmental interventions to increase and sustain changes in the positive behavior and to decrease and sustain changes in the negative behaviors. So ABA is great for a kid with significant skill deficits and significant behavioral excesses. So if the child has behavior that wildly ranges or that it's inconsistent, especially, ABA is going to be great for that. It's really good at analyzing exactly what kind of environmental contingencies produce the best behavior and what kind of environmental contingencies produce the worst behavior. So if your child has behavioral excesses or behavioral deficits that vary a lot or that sometimes seem to come in bursts or that seem to make no sense at all, ABA is going to be great for that. However, if your child seems to have mood issues that aren't necessarily so extreme, but that seem to affect them, then maybe some kind of talk or play-based therapy would be more appropriate, okay? So parents, this is what I want to ask yourself. How old is my child? If your child's really young, they're probably going to benefit more from ABA or from play-based therapy. How insightful is my child? If your child's super insightful and has a great verbal, repertoire, then they might be able to participate and benefit from CBT. If their vocabulary is kind of limited, then ABA might be more appropriate. And then ask yourself, how severe or serious are the behaviors? Does it make sense that my child's having issues adjusting to something? If it does, then like I said, maybe more of a play or experiential-based therapy like play or CBT will be more appropriate. But if you ask yourself, well, is the main issue the behaviors? Am I getting a lot of behavioral excesses? Does my child seem to have significant deficiencies in their social repertoires, deficiencies in their emotional behavioral regulation skills? If you're getting a lot of deficiencies or a lot of excesses, behavioral therapy is definitely going to be the most effective choice. Also think about it from a parent's perspective too. With CBT or with play-based therapy, they are going to include parents in that type of therapy, but not nearly as much as you would be for ABA type of therapy. Remember, intensity and frequency is important here too. Most play and cognitive behavioral therapy is going to be conducted at most 1 hour a week, every week. So most ABA, so here at our facility, we don't take cases less than 15 hours a week. So ABA is much more typically intensive, done at a much faster, more intensive rate than play or CBT therapy is going to be done. So parents, I want you to consider, do you feel like you have the tools and you have the skills you need, and do you feel like your behavior as a parent is really influencing the behavior of your child? If you do feel those two things, then you're probably going to want to pursue behavioral therapy in conjunction with some other type of therapy. And this is a common arrangement, by the way. Many parents will seek consultation from me as a professional, just kind of helping them adjust their strategies, techniques, helping them build their repertoire, while also getting their child their own therapy through play-based therapy or through talk therapy. So parents, you have options. I just want you to be able to make good choices for those options. So remember, the differences in those types of 3 therapies. Play is going to be much more for younger children who have a limited verbal repertoire, who really utilize play as their primary way of expression. It's going to be really good in that process-oriented type of experience, and it's really going to be good at helping identify emotional adjustment, emotion-based types of issues. CBT is going to be probably for older kids with a higher verbal repertoire who show that insight and ability, like I said, to self-adjust or self-manage. Behavioral therapy is by far going to be the best type of therapy when you're dealing with large groups of behavioral excesses, behavioral deficits, inconsistent behavior, or behavior that you really can't predictably control or manage. Behavior therapy is by far going to be the best type of therapy for that. So parents, we want to thank you for joining us today. We want to encourage you to please submit your questions to us at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale of philipcarnevalephotography.com. We want to thank you again for submitting those questions and for joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.